Prostate cancer is affecting many men worldwide. One major issue is that most people are not aware of their symptoms, leading to delays in treatment. Understanding the signs helps catch the cancer early. Today, we will learn 10 signs of prostate cancer that many people overlook. What is prostate cancer? The prostate gland is a small, walnut-sized organ located just below the bladder and in front of the rectum. It surrounds the urethra, which is the tube that carries urine and semen from the bladder out through the penis. In prostate cancer, cancerous cells begin to grow uncontrollably within the prostate gland. Here are 10 major signs of prostate cancer. Number 1. Trouble urinating. Let's start with one of the most common but overlooked signs of prostate cancer: trouble urinating. It usually begins as a minor annoyance. The person faces difficulty starting the urine flow, even when there is a strong urge to urinate. It feels like you need to go, but when you try to urinate, you have to wait for the stream to begin, or the stream may start and stop or be weaker than usual. But the question is, what causes trouble with urinating? The urethra runs through the center of the prostate gland. As the prostate tumor grows, it causes the prostate gland to enlarge or swell. This growth is generally uneven and presses against the urethra. This pressure narrows the urethra, making it difficult for urine to pass through. It's like squeezing water through a narrow straw. The flow becomes slower and more difficult. Well, it is important to know that while trouble urinating is a sign of prostate cancer, it is also a common symptom of less serious conditions, such as benign prostatic hyperplasia, which is a non-cancerous enlargement of the prostate. So, it is important to consult your doctor to avoid later regrets. Number 2, increased urination frequency, especially at night. How many times do you get up at night to use the bathroom? If it is becoming more frequent and interrupts your sleep regularly, take it seriously. This is more serious than the annoyance of losing sleep. It is a subtle warning of the early stages of prostate cancer. It's because of the location of the prostate gland. When prostate cancer progresses, the growing tumor causes the prostate gland to enlarge. This is a key factor in many urinary symptoms related to prostate cancer. The enlarged prostate presses against the bladder. This pressure decreases the bladder's capacity to hold urine, making it less able to store urine for normal periods. As a result, the bladder signals the need to urinate more frequently, even if it's not full. Also, the prostate tumor leads to irritation or inflammation of the bladder and the urethra. This irritation makes the bladder more sensitive and causes the urge to urinate more frequently. This feeling is similar to the urgency of a urinary tract infection, but here it is caused by the physical and chemical changes from the cancer. Besides these, the tumor's growth also disturbs the normal nerve signals between the bladder and the brain. These disturbed signals cause the bladder to believe it is fuller than it actually is, leading to an increased frequency of urination. So, don't let nighttime bathroom runs become your new normal, and consult your doctor. Number 3. Pain or burning sensation during urination. Now, this next one really needs your attention. Experiencing pain or a burning sensation during urination is another warning sign. People mostly consider it as a urine infection, but it's more than that. It is an indicator of prostate cancer. This burning sensation varies in intensity, ranging from mild discomfort to severe pain during urination. Some men describe it as a sharp stinging sensation. You usually feel this pain during urination, but also sticks for a short time afterward. The pain is mostly felt in the urethra, but sometimes it also occurs in the bladder or at the tip of the penis. The reason behind it is, again, the enlargement of the prostate gland. This enlargement compresses and narrows the urethra, the tube through which urine passes from the bladder out of the body. The compression of the urethra makes it harder for urine to pass through and also causes irritation and inflammation of the urethral walls. When urine flows through an inflamed urethra, it causes a burning sensation. Sometimes prostate cancer leads to changes in urine composition. For example, the urine becomes more acidic. When more acidic urine passes through an already irritated urethra, it worsens the burning sensation during urination. Besides, prostate cancer also makes patients more receptive to urinary tract infections due to incomplete emptying of the bladder and the stasis of urine. This provides a breeding ground for bacteria. A UTI further irritates the urethra and bladder, intensifying the burning sensation when urinating. Number 4. Blood in urine or semen. Another alarming signal that you should never ignore is blood in urine or semen. While it could be related to other health issues, blood in urine or semen also indicates prostate cancer. It is a visual clue that something is not right inside, and it's worth consulting a doctor. Normally, the blood in urine is visible as a brown, pink, or red discoloration. But sometimes it is not visible and is only detected under a microscope during a urine test. It's because, as prostate cancer grows, the cancerous cells attack and infiltrate neighboring tissues, including the bladder and the urethra, which are parts of the urinary tract closely associated with the prostate. This attack damages the blood vessels, which leads to bleeding in the urine. Also, prostate cancer causes inflammation in the prostate and surrounding urinary structures. This inflammation increases blood vessel permeability, sometimes allowing blood to leak into the urine. If you guys are wondering why there is blood in semen, it's because prostate cancer also spreads to the seminal vesicles, which are involved in the production of semen. If the cancer attacks these glands, it disturbs their function and integrity, leading to the presence of blood in the semen. Also, the prostatic ducts through which semen is expelled are affected by the cancer. If these ducts are infiltrated or damaged by the tumor, it results in bleeding into the semen. Number 5. Dribbling urine after you finish urinating. Another symptom that is quite hard to believe is dribbling urine after you finish urinating. Yes, it's true. Dribbling urine is more than a minor annoyance. If your urine is dribbling after you think you have finished, is a subtle but major symptom of prostate cancer. Let's break down what happens in the body to cause this symptom. As you know, the enlargement of the prostate gland directly affects your bladder and urethra. The squeezing effect of the enlarged prostate on the urethra leads to urine being trapped in the urethra after the main flow has stopped. When you move, change posture, or after some time has passed, this trapped urine leaks out, leading to dribbling. Also, over time, as the bladder works harder to push urine past the prostate obstruction, its muscles weaken and become less efficient. This weakening results in incomplete bladder emptying, causing post-urination to dribble, as leftover urine slowly leaks out after you leave the bathroom. Another reason that contributes to urine dribbling is that prostate cancer also interferes with the nerves that help control the bladder and urethra. Disruption in these nerve signals leads to poor coordination between the bladder muscle and the urethra, further complicating the issue of completely emptying the bladder. Number 6. Erectile dysfunction. Let's talk about a sensitive issue, erectile dysfunction. Struggling to achieve or maintain an erection is distressing and affects more than just your sex life. It could also be one of the first signs of prostate cancer affecting your prostate's nerves and blood vessels. Remember, it's not about improving your love life, it is more about checking what's causing the issue. The prostate gland is located near key nerves and blood vessels that control erectile function. These nerves and vessels are part of the neurovascular bundle alongside the prostate. They control the blood flow to the penis and are important for achieving and maintaining an erection. As prostate cancer develops, the tumor grows and expands beyond the prostate gland itself. This expansion puts pressure on, or even directly attacks, these nerves and blood vessels. The disruption or damage hurdles the normal blood flow and nerve impulses important for an erection. Erectile dysfunction related to prostate cancer is far more than a sexual health issue. It is a quality of life concern that significantly affects emotional and mental health. Understanding the root causes of ED in prostate cancer patients helps them maintain a fulfilling life and manage the disease's physical and psychological impacts effectively. Number 7. Dull pain in the lower pelvic area. Feeling a dull pain in the lower pelvic area? It is easy to dismiss this after a busy day or blame it on some forgotten physical activity, but persistent pain in this area could be your body hinting at prostate issues, including cancer. The reason is that besides compressing the bladder and urethra, the enlarged prostate gland also impacts the other adjacent organs and tissues. The growing prostate puts pressure on nerves, muscles, and even bones in the pelvic area, leading to a dull, aching pain. In more advanced stages, prostate cancer attacks nearby tissues directly or forms small metastases that lodge in the pelvic bones or lymph nodes. This affects the normal tissue integrity and is painful. If the cancer reaches the bones, it leads to bone pain, which is mostly described as dull and deep-seated. Besides, as discussed earlier, cancer growth causes inflammation in and around the prostate. This inflammation spreads to the pelvic region, irritating tissues and enhancing the feeling of discomfort or pain. The body's immune response to the cancer further worsens this pain through swelling and increased sensitivity in the pelvic tissues. Number 8. Unexplained weight loss. Have you noticed you're losing weight without trying? Is your appetite not what it used to be? These general symptoms are normally ignored as one-off issues. But combined with any other signs we have mentioned, they indicate more serious problems like prostate cancer. One of the main reasons for weight loss is increased metabolic rate. Cancer cells usually have a higher metabolic rate than normal cells. As the tumor grows, it consumes more energy and nutrients from the body. Even if the patient is consuming a normal diet, the cancer cells use the energy, leading to weight loss. Also, prostate cancer leads to the release of cytokines. In case you don't know, cytokines are inflammatory molecules that affect the brain's hunger and satiety regulation. This reduces appetite, resulting in weight loss. Number 9. Continuous back, hip, or thigh pain. If you have continuous back, hips, or thigh pain, it is not only from sitting too long or overdoing a workout. Prostate cancer is also the reason behind this pain. Prostate cancer commonly spreads to bones, especially the spine, hips, and pelvis. When cancer cells attack bone tissue, they cause significant pain and discomfort. Bone metastasis weakens the bones, leading to fractures and additional pain. As prostate cancer grows, it presses against nerves in the pelvis and lower back. This compression causes pain that radiates to the back, hips, or thighs. Spinal cord compression also occurs, leading to severe pain and neurological symptoms. The cancer itself causes inflammation in the surrounding tissues, leading to pain. This inflammation affects muscles, bones, and nerves in the lower back, hips, and thighs. If you or someone you know has ongoing pain like this and a history of prostate issues, it's important to see a doctor for proper treatment. Number 10. Numbness or weakness in legs. Your legs carry you through life's many journeys, but when they suddenly feel weak or numb, your body indicates something is not right. Well, it could be due to many reasons, but it is also an alarming symptom of prostate cancer. One of the most common reasons for numbness or weakness in the legs in prostate cancer patients is the metastasis of cancer to the spine. The vertebrae and spinal column are common sites where prostate cancer cells spread. As the tumor grows within the spinal column, it compresses the nerves. These nerves send messages from the brain to the legs regarding movement and sensation. Compression of these nerves disturbs these signals, leading to sensations of numbness, decreased ability to move the legs, or even pain along the nerve path. Also, tumors have a great impact on blood circulation. Large tumors in the pelvic or spinal areas hinder blood flow to the lower regions of the body, reducing the amount of oxygen and nutrients that nerves in the legs receive. This deprivation causes nerve cells to function poorly, weakening and numbness. Recognizing these overlooked signs of prostate cancer helps in early detection of it. Remember, the earlier prostate cancer is detected, the better the chances of successful treatment. If you notice any of these signs, please consult your doctor immediately. If you enjoy this video, please give it a thumbs up and share it with your friends. Also, subscribe to our channel to see more videos. Until then, stay hydrated and stay healthy.